Good evening, everyone. This is Vera Sadler with VLS Coaching Services and Women in Life Ministries, and we are here live tonight with my great friend, Dr. Maudia Gentry from Community Health Training Institute. And I'm so excited tonight because we get to talk about a topic that many of us in minority communities don't discuss. And Dr. Maudia, who is an expert in this field, she has shared in this field with me on many, many occasions. And she's going to come and share her expertise on health and disparities in minority communities. But Dr. Maudia is here tonight to discuss with us on physical, on our healthcare in minority communities, and to talk about what it is we need to do to begin to take care of ourselves in a better manner. And I know, Dr. Maria, you and I have shared on many occasions about how we don't do enough to take care of ourselves, how we don't do enough preventive maintenance, how we don't do just going to the doctors, how we don't I love what you did last, not this last time, the last two times. But I was just sharing with a friend, I think it was 2 days ago, about the conference we had in June. I think it was June, not the one we just had in September, but the one we had in June when you showed us and you taught us how to take care of ourselves at different ages, how you actually laid it out for all of us women to have as we grow from the ages of 20 all the way through the age of 90. You gave us a healthcare plan and what it looked like. So, guys, I wanted to come and share my girlfriend, Maudia Gentry, with you tonight because she has just helped me and a whole bunch of other individuals learn how to better care for ourselves in health and just take care of ourselves. So, Maudia, I'm not going to keep talking. I'm going to let you start jumping in because I know you always have a lot of great information to share. But I am going to say this last time you shared, you told us about how different things affect our body, how even emotional. I think when you told us how stress affect our kidneys and how different emotions and different things attack our physical body and different just emotions, I think you blew away the whole room. And we were all like, "Oh my gosh, I need to stop that. I need to stop doing that." And how we learned. So that's why I really wanted to share you with the rest of the listening group, whoever may come on, whether they're going to hear it tonight, whether they're going to hear it next week, whether they hear it a month from now and they can go back and replay it. I wanted individuals to hear just this knowledge and start getting hands on and a handle on their health, because I think too many times we ignore it. And I know for years you've been telling us, stop ignoring your health and the signs. So come and introduce yourself to the group or to the people that'll be listening, that'll be logging in, and just hit it. Hit the ground running and tell us what you have to share with us tonight.
Well, good evening. My name is Maudia Gentry. Dr. Gentry, as some people call me. I do not have an MD degree. I have an EDD, but I've got several years of working in the community and working with people that are with health challenges. Many times people have lots of health challenges. And what we do see a lot of the times is they don't know signs and symptoms. So I worked in the community from Houston to Dallas, back to Dallas. What we do know is that Afro Americans, when we start talking about health disparities, we're talking about a lot of issues and a lot of variables and factors
Mhm.
that happen. But a lot of times in the end, it has a lot to do with our health. And one of the biggest challenges, and Vera, I got a feedback. I don't
Okay.
know. Mm,
Oh, because it says that you logged on twice.
okay, can you take me off the window?
Let's see if we can remove you.
Okay,
Okay, let's see. Try it now.
okay, great. Okay, Vera. Let's see.
Sounds great now.
Yeah, it sounds great, but yeah, okay, wait a minute, Vera. Now I don't know where I am. Hold on.
You're perfect. You
Am I
just
perfect?
you're
Okay,
perfect.
y'all, I'm gonna take it from there. One of the things I want to just really go into is y'all knowing the signs and symptoms of disease. What we do know a lot of the times is that when Afro Americans go to the ER, many of us have been suffering for a long period of time before we got to the ER.
Mm-hmm.
Across this country, the health disparities are huge as it relates to Afro Americans. So when we look at the whole concept of health, we have to go back and we have to look at the perception of disease. So one of the trainings that I'm offering this week, it has a lot to do with the perception of disease. Let's look at COVID. COVID is a prime example. Many of us were really just afraid and not knowing why we were so fearful of COVID. Yes, COVID was a very, very bad thing. But a lot of us did not take precautions even after we were told to. And it had a lot to do with the signs and the symptoms of the process of disease. I want to go back, Vera, just a little bit back and talk about what happened and why we are very fearful. So one of the trainings I've just published that is state approved, it's called Traditional Health Historical Perspectives on Health in Afro American Communities Impact COVID Outcomes Presently. This is mainly for Afro Americans. So, what we do know when we go back and we look at the perception of disease, we've got to look at how disease is defined. Many
Mm.
of us define disease as sick. If I'm and if, and I've got to be sick, and I've got to have a couple of symptoms to go along with it. Well, that has a lot to do with our history with the healthcare industry. One of the things that we know about COVID is that COVID pulled the layer off and showed what many of us knew about marginalized communities, communities that didn't have a health clinic, communities that are food deserts, communities that are food swamps. Do I need to just keep going? Just all
Wow.
different types of barriers. And those barriers are called the SDOH. Those are social determinant of health barriers. They've been there for years now, y'all, but now we're taking a whole look at all of these barriers. These barriers affect how you receive health, how you perceive health, if you got transportation, if you don't, to go to the doctor. So we got to look at that. COVID really showed and pulled out layers and layers of what was going on in marginalized, disfranchised communities. And a lot of it had to do with
Mm.
social bias and the belief systems. So when we looked at COVID, we started wondering, well, wonder why Afro Americans are not getting the vaccine as quick as others. Let's go back and talk about the culture of Afro Americans. So when you look at the influence of sickness and disease, you must look at health. You must understand wellness. You must understand illness. Health beliefs about disease among Afro Americans can vary across the community and the belief system about health, age,
Mm.
social status, education, geographic location, and childhood and economics. So
That's
let's
a
look.
lot, Maudia.
I know, Vera. So
No,
let's
I'm
look
saying
at that.
that's a lot because you said something in the beginning that really just I'm still stuck there when you said we only think about it as the sickness. We're not thinking about this as this whole package you're talking about.
Right, right. And always remember, I always tell people when I'm teaching, we have body systems, right? You've
Hmm.
got a respiratory system, you've got a digestive system. Remember, you got systems. Your body is made up of these intricate systems. But what we want to think about, y'all, is when we take care of one system, if we're not careful, a lot of times that other system needs a little love and care too.
Hmm.
So when you start looking at all of the things about marginalized communities and disadvantaged communities, then you have to go back and you have to look at the culture. You also have to look at the perception of disease.
Mm.
What we do know from literature is that Afro Americans do not perceive disease the way others do. Has a
Okay.
lot to do with the way we were raised. Has a lot to do with what we were taught on disease. And a lot of times we believe that disease is one thing, and disease can be something totally different. Totally different. So when you talk about us and you start to think about our health, you've got to start thinking about how we perceive disease, what we think, and the belief system.
Can you
So,
explain that a little bit more when you're saying we believe it could be something we're
oh
believing
yeah,
disease and
yeah,
just a little bit because I perceive I'm thinking that somebody can hear you saying that and they don't understand what you're saying.
yes. So belief system. Let's go back and think about. Okay, I'm gonna use myself as an example here. I remember growing up, and when I was growing up, I went to the doctor on a regular basis, but it was only for school shots, Vera, and an emergency. That was
Right?
it. Okay.
That's it.
That was it. So anytime there was something happened to me at my grandparents' home, a lot of times they had all kinds of remedies. We know those remedies.
Mhm.
They're,
Mhm.
they're, and that you don't believe that, but now it impacts how you think about disease.
Okay.
So a lot of us, with the way we were raised and the way we were taught about the perception of disease, we are not so much into the prevention of it, Vera. It has to happen.
Mm. Mhm.
We've got to see active signs and symptoms that something is wrong with me.
And that's the wrong way to handle it because
Hmm.
prevention keeps you
That's
from
true.
being this active. We don't want what you've taught me is that prevention, and we all know prevention really is the best medicine.
That's true. That is very true. So we now got to look at the traditional definition of health, and it comes from many different belief systems. So many beliefs are about life and historical events have been passed down to us from past generations. When they pass down the history, they also pass down the perception of disease.
Mm.
So
And so,
let's
what you're saying is this is something that we really have to shift in our
yes,
mindset,
thank you, Vera.
shift not just in our mindset, but also in our cultures. And if we don't begin to start shifting that, we're going to stay in the hospitals. And I
Hmm.
like the way you brought out the point, Maudia, that COVID pulled back this layer because, of course,
Oh
it
yeah.
showed us that we're unhealthy. It showed us how truly sick we were physically because we
Hmm.
weren't prepared for the disease that attacked or when the sickness came. I think that is what I'm hearing you saying that when you pulled it back and you saw our communities and what they were really lacking.
Yes, yes. And one, let me say this, Vera. Many communities are cluttered with food deserts.
Mm-hmm.
Food deserts are food swamps. The difference is food deserts is that there are a lot of places to eat, but they're not healthy places.
Okay.
Okay. Food swamps mean that you got not that many places to eat, but it's just maybe one whole strip of nothing but a swamp. There is nothing else there. So every day you eat a particular thing that's not healthy for you. Well, guess what happens? Eventually, you start to see signs and symptoms of your body going, hey, you're not taking good care of me. I'm not getting vegetables. I'm not getting enough water. I'm getting other things. So either way, if you live in a food desert or you live in a food swamp, let me go back and talk about a little bit about a food swamp. A food swamp means that you have to travel 1 to 2 miles out of your community to go get fresh fruits and vegetables. That's a food swamp.
Okay.
That's a food desert, excuse me. A food swamp means you might have 20 different places to eat on one strip. Just drive up and down that strip. One day you eat this, one day you eat. But when we say, well, what did you eat? You say, well, I would eat better if I had better choices. Both of them, Vera, we're seeing in marginalized communities.
Mm-hmm. Mm-hmm.
I believe Dallas has about 44 food deserts, and I think Fort Worth is close right after that. So that
Wow.
tells you, just think if you live in a food desert, and just let's look at that. If you don't have transportation, you're going to eat what's in the community.
Yes.
And you can attend all the trainings that I do, but when you're like, this is good information, but I live in a food desert. What can I do with this?
Mm-hmm.
And I might have limited transportation. That's going to be a huge challenge. So
You know, that's
so
an excellent point you brought up, because even when I went to the grocery store earlier today or yesterday, my daughter and I, well, we traveled and we went to a different store so that I could get fresher vegetables and fruit. And you're absolutely right. I had to drive almost 25 to 30 minutes away from where I live
mhm,
because the vegetables and fruit at the local store are junk, and because my husband and I are trying to do take much better care of our health. My husband always eats fresh, but I'm trying to do better after attending so many more of your trainings, and just we're on this thing, you know. I'm hitting 50. I'll be 59 in a couple of months, hitting 60. But with all this, I had you just said it. I had to travel, and thank the Lord I have a vehicle, but what do the people do that don't? And our, you
yeah.
know, we don't have the best public transportation here in Dallas.
No, no, you don't, Vera. No, you don't. So see all of that, and then think about that. You wrote with your daughter to be able to get some fresh fruits and vegetables. Many people don't have that they do not have that. That is not even an option for them.
Mm-mm.
So then when we start to think about that, now we're thinking, and then when we look at that, we're thinking, well, okay, no car. What can I eat? Then we a lot of times we have to eat whatever we can afford, or we have to eat whatever we have, or we have to eat whatever someone might take us to get. So see, all of that goes into health. Many of us think health is one thing. Health is a lot of things rolled up into one. Prevention, regular checkups. What do you think about disease? What's your perception about different types of diseases? And the way we were raised really sets the tone, Vera, for how we perceive disease.
Mm-hmm.
I
Mm-hmm.
can think of as being a little girl, when I would play outside, I'd get in ant beds and all kinds of stuff. Well, a lot of times my grandparents did not have different things to put on my scraps and big bites, ant bites. So guess what? My grandmother would pour alcohol in my bathwater.
Mm-hmm.
She
Mm-hmm.
would also put a mixture of little flour together, and guess what? Put it on where I had been bitten or I had scratched it, and guess what? It stopped itching immediately. See, those are those old home remedies that many of us still use. That has a lot to do, Miss Vera, with different ways, the way we look at disease. So many beliefs are about life, and historical beliefs have been passed down about illness.
So can I ask you
Laxative,
a question
sure.
with that? Because I know you probably had some other way to go, but this conversation is so interesting to me, because when you're dealing with individuals with these historical beliefs,
Oh, yeah.
and then you started out the conversation with when we end up, our
Yeah.
people end up in the ER.
Yeah.
So now we end up in the ER because now we have all these blown out symptoms. And I will tell you honestly, my father passed away at the age of 59 from renal cancer. But by the time he passed away, Maudia, he had so many tumors. When he first went to the doctor, they told him it was a hernia, like in his thigh area.
Yeah.
But it had spread. But of course, he wasn't getting regular checkups. He wasn't going getting things. But of course, I think they misdiagnosed him. They told him he had a hernia. But by the time he passed away, I think it was within 6 or 8 months later, he had so many tumors all over his entire body. You could rub your hand down his back and you could feel the lumps. You could rub your hand, and the it was almost like it had legs and it had spread from his renal area. You could feel like the veins of it. But I mentioned that because you're talking about how we wait
Mm-hmm.
until we have all these symptoms
Mm-hmm.
and these issues and these oh, and I feel like we wait till we have these overwhelming problems that now we want an emergency room doctor to do what should have been preventive medicine, or when it's become acute. I think that's what I
Mm-hmm.
want you to address. We go to the ER and now we have acute symptoms when it could have been something that was preventive all of long and not cause us to be an emergency room visit.
Mm-hmm. So to solve that, Miss Vera, you need to have a primary medical provider, better known as your medical home. I always say to people when I'm teaching in the community, I will ask them, I'll say, do you have a medical home? They say no. So when was the last time you saw a doctor? When I was sick in the ER. We've got to learn to have a relationship or develop a relationship with a medical provider. Why? Because we need to be going and following those screenings. There are so different many screenings, y'all, we should have as women, as men, and making sure. And it has a lot to do with age.
Mm-hmm.
The older you get, the more you should be seeing your doctor. If you have hypertension, which the research shows that a huge amount of Afro Americans in this country have hypertension, and then we also have a large group that refuse to take their medicine, and even larger group that will say, "I don't think I have it."
Denial.
Untreated hypertension leads you down a very bad road of other consequences.
Mm.
And a lot of us have been told, oh, you can treat it with this or you can treat it with that. One of the things when I was working on this training is really some of the things we used back in the day to treat different things. We use laxatives for everything. Everything.
I'm sorry.
Everything. Oh my God. And the research proves it. We use cod liver oil. Cod liver oil was given to children to prevent them from having colds. If you said, I sneeze, they say, come here, let me give you some cod liver oil.
Yes, I remember.
See, and a lot of our older Afro Americans and people, they use copper bracelets and silver, and they would put
Okay.
that around their wrist or around their ankle. They believe that would stop disease, and that is commonly still used today. Once again, those are things that have been passed down to us. So a lot of us will say, well, my mother or my such and such used this and they were healthy, but it was a different era, a different time.
Mm-hmm.
So now what we need to do, the best thing we could do is make sure that we practice prevention. Find out when your screenings are due. Find out when you need to have a yearly exam. If you've got something going on and only you know your body, if you got something going on in your body, get to a provider. Find yourself a doctor and find yourself somebody that you can trust and you can talk to. That's
Outside
huge.
of tradition, why do you think people ignore the symptoms in their body? I mean, I believe
Mhm.
there's several reasons, but why do you think we ignore the symptoms we have? Your stomach hurts for 3 4 months, and
Ooh.
you just say we take something, you take Tums or you take stuff, like you're saying, or you have this bad cold or you have all these things, and you should go see a provider and let them really, because we all think we got a home MD. We're not medical doctors. We self-diagnose. And I know you've talked about that in some of your workshops you've done with us, to stop self-diagnosing and really get in to see someone
Yeah.
who has the ability to diagnose what's going on.
A lot of our patients are in the stages of change, Vera, and I'll just make that quick. When we talk about disease and prevention, we have to talk about the stages of change. The
Okay.
stages of change are commonly used social services, healthcare. And what it is really, where is your patient? Where are they emotionally? Where are they? So when we're saying to somebody, Miss So and so, have you had your yearly exam? No. Your patient is in pre-contemplation stage, and that's what most of us are, Vera. We are pre-contemplating. We don't even realize, and we don't want to realize that it might be something wrong with me.
Oh, wow. Okay.
So I am in pre-contemplation. You just told me that I need to make an appointment with my doctor. But in my mind, it's nothing wrong with me. So I'm going to pre-contemplate for another year or two.
Wow.
Now, if I'm in contemplation stage, and you can Google stages of change, y'all, they're huge. And it's human nature. It's just human nature. When you're working with a patient, Miss Vera, and you see that that person is in contemplation, the conversation that goes something like this: Doctor, do you think I might have such and such? See, they're thinking now. They're really beginning to think, well, wait a minute. Doctor answer will give them an answer, and then they'll come back and say, well, doctor, what do you think I should do? Well, so and so, I believe you should do such and such. Now, I might not want to hear that, but I leave out of that office thinking, now I got to weigh it. Do I want to ignore this, or do I want the screening of the procedure to see what's wrong with me? But I am past the pre-contemplation stage, and I know I've got to do something. That's what many of us are, Vera. We're nowhere up the ladder on the other parts of stages of change. We're either in pre-contemplation or contemplation. Many of our patients are in pre-contemplation. So, Mr. So-and-so, you know you have diabetes. I need to make you an appointment. No, I don't have diabetes. I just had too much soda drink in the last couple of days. That's it. That person is in contemplation. They don't know they're in danger. So that has a lot to do with what we think about disease, how we even treat our bodies.
So I'm pulled up these stages of change.
Yes.
So we got the pre-contemplation and the contemplation. Then I guess we move to, I don't know whether it goes to action or levels
Action.
of change.
That's it.
So is there a big gap to move individuals from contemplation to action? Because it's almost like it's a big to move from pre-contemplation to contemplation. But so what I've learned from working with individuals and also working with you is that we have to get individuals in our communities, in our minority, our marginalized communities, our underserved populations. We need to get them from some of our old traditions that may have worked, but we need you to really care about your health care. That's first.
Yes.
And we need to get you somewhat educated. We need to get individuals that will go and sit and maybe talk to them and discuss some things. And I know I've talked to people who said, oh, I just had a friend the other day I was talking to, and she said, my mom is stuck in her ways. She just thinks that this is going to work. And we're like, but your health needs to be addressed, and you're just stuck that this is going to work. That's not working. I need you to, address that. So just had this conversation with a friend the other day.
She's in pre-contemplation.
And so now we need to but it's like, we need to find a way in our communities to move individuals from pre-contemplation to contemplation and now really to action, because we want them to live long. We want them to be healthy. We want them to be well. But I also find sometimes when I'm dealing with family members that aren't older, it's just, well, I don't have time to go to doctor. I feel like that's the other phase. I don't have time, but you have to make time. So I make time for my health care. I go to my annual screenings. I go to my follow-up appointments. But I think another piece of this too is finding, you said you have to have a relationship with your home. So, I think you and I were talking about it. I had to find a doctor that wasn't pushing pills, that wasn't just say here, 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 but a doctor that I felt comfortable with, that really, one, understood Afro-American healthcare, which our health is different, but then also a doctor that I felt like was really trying to care for me, not just give me medicines, but actually overall care. And
Yes.
have you I know you work with people in this industry, Maria, but have you really just seen how hard is it to get individuals to action?
I just had this conversation with my mom a couple of days ago, and we've got to learn to be our own advocate.
Okay.
Okay. So that may, and a lot of us, Vera, from the era and the time we came from, many of us will not challenge our physicians. We won't ask any questions. We won't come back and say, oh, doc, I think this is not working because I'm still having. We won't do that. So, one of the things, Ms. Vera, is that we've got to become our own advocate.
Mm-hmm. Mm-hmm.
We've got to be able to step up and say, doc, I need to talk with you because this is not working for me.
Mm-hmm.
That's a huge piece. That's what we've got to do. We've also, Vera, got to take a step back and start really saying, I need to take care of this body. This is the
You only
only
have
body
one.
that I have, so I need to make some real serious changes and take care of it. What happens a lot of the times is that, Vera, when we get to the point we're going to take care of our body, our poor body is already saying, hey, look, I don't even with you helping me now, I'm really kind of tired. We've also got to stop ignoring the signs and symptoms.
Mm-hmm.
We've got to really, really, Vera, educate ourselves and start looking at different things and make note of things. Maybe you notice that your foot is swollen. Maybe that's something you need to start making note of. And I'm not saying make note of it for 6 months. I'm saying 6 days or less. You get yourself to a doctor.
That's really good. That's really good information. And I, for all those that are listening to this conversation, I know you're saying, oh, they're just like bashing us about taking care of us. No,
No,
we are trying to encourage our people in our communities to really start caring. We have elderly parents, we have I have a daughter, I'm always on her about get to the doctor. Just the other day I called, she was on the phone with me, she was sick. She'd been sick for 2 weeks with this nasty sinus infection. I put her on hold. We were having I said, oh, hold on for a minute. I called the doctor and booked her. Then I looped her in a conference call. I said, hey, so and so, I have, and she's on the phone. Can you make her an appointment so she can come in and get this cleared up? And so then she was forced to go in because she didn't want to. She's that type. She didn't want to like put me on blast with the doctor because I had her on 3-way. But she got in, got her some antibiotics because she had this nasty sinus infection
mhm,
that was going on. But she wouldn't call, and I'm like,
mhm.
but she'll take her kids. But she won't. And I'm like, but if you're not alive, who's gonna take care of them kids besides, So it's that
Mhm.
kind of thing. You
That's
have
right.
people who won't take care of themselves. And I'm like, girl, you need to advocate for your own health too, not just your children. So I'm just want people to hear this conversation and realize we're not just saying it. And I remember several years ago, I've known Dr. Maudia for probably about 7 years now. But I remember when you were really sick, Maudia, and they kept telling you it's this, and you weren't getting any better. And you kept pressing until you found a doctor that treated your symptoms.
That's right.
And you kept going and you did not stop and you didn't let them pass you over as if I'm just going to take that and I'm going to keep this sickness in my body. And you found a doctor, which was a blessing because I had some similar issues and I was able to go and figure out what was wrong with me because I went to UT Southwestern and they just told me, oh, nothing's wrong with you. But I wound up going to the doctor. We both had some pulmonary issues going on.
Mhm,
And I went
mhm.
to your doctor and he was able to take care of me and tell me what was literally going on inside of my lungs. And I had been suffering with that issue for 2 years. But UT Southwestern charged me all this money and did nothing. And so what we're saying tonight is, like you said, advocate for yourself and get
Oh
to
yeah.
the doctor. And I shared with you that recently, as you know, I take high blood pressure medicine. my doctor had me on all this different medicine, but I was suffering with so much fatigue, and she kept saying, "Oh, just let the medicine work." But I had got to the point where I felt like I was going to pass out. But I had to go back to her and say, "It's not working." And she decreased my medicine. My blood pressure was so low, it was making me like I was about to pass out during the day. Every day I was crashing. But she was able to take me off of it because I went to the dentist and my blood pressure was so low, they almost didn't want to treat me. But like you said, pay attention
Oh
to your
yeah,
symptoms.
that's
Pay
true.
attention to your sign and find someone that listens. If your doctor's not listening, find someone that will listen. And it's sad that we have to say this, but there is a disparity in healthcare sometimes. Not all
Mhm.
doctors are this way, but you and I were having a question. I don't know if you want to hit on this tonight or we're going to come back and have this conversation. Um, we have about 25 minutes left, but I don't know if we want to talk about this tonight or if we just want to keep talking about, because I think you had some stuff you wanted to share about health.
Yeah, and one of the things I wanted to talk about, Vera, is trust versus mistrust in the Afro American community. A lot of this stems from the perception of trust and mistrust. A
Okay.
lot of it stems from the mistrust because of the history that we've had with the healthcare industry in America. So a lot of this has to do with the perception of mistrust, and some of it's being traced as far back as to slavery.
Mm-hmm.
So one of the things you look at, and y'all, it's amazing. But when I was doing the research, I found so many different things about trust versus mistrust with the Afro American community, and it's a major problem. So when you look at trust, trust promotes better patient trust and better patient engagement. This is on the patient and the doctor side. But if you have a patient that distrusts, that, believe it or not, y'all, that inhibits this whole care seeking behavior. And if I don't trust you, I'm sure not going to make an appointment to come and see you.
Exactly.
So, by the way, I can't find who I really trust, so I just don't go in at all.
Mm.
So, in order for us to understand this whole concept, in order to understand mistrust in the Afro American community, we must look back to some of the historical roots, and let's take a look back. One of the things that we all know about is the Tuskegee study.
Mm-hmm.
Huge issue, and it laid the groundwork for mistrust.
Yes, years.
There you go. So a lot of us are still to this day at that point. So we stay out of the doctor's office and we only show up in the ER when it is a true emergency. And I mean a true emergency. So
Mm-hmm.
in this country, some of the medical mistrust that has happened in the United States, we have a long history of discrimination. So
Mm-hmm.
now you have Afro Americans that will tell you, no, I don't trust that situation. I'm gonna go over here and take some stuff that my somebody gave me, and it might not help me, but I just don't trust. And
Right,
if you
right,
go
right.
back and look at the literature, there's a lot of literature when I was doing the study review. It talks about some of the concepts and things that have happened to us in the 19th century, which is the early 1800s. 90% of Afro Americans lived in the South. Now, listen to this, a high percentage of these individuals were slaves. Physicians used slaves as subjects for experimentation, for developing cures for disease for profit.
Wow.
That in itself, see, you see the layers of it, Vera, of why where we are in some aspects. You also see the layers of how a lot of times there's, oh my goodness, I won't get into it. But if you go and you look at trust versus mistrust and some of the human experimentation that was done on slaves and even after slavery, it brings it, there were some times where I couldn't even do it. I had tears in my eyes. Some of the pictures made me cry. So that's a huge challenge right there.
Mm.
Then when we go back, we look at the informal consent. Now you cannot treat a person if you don't have
100%.
informal consent. You sure can't do experiments on them if you don't have their consent. But remember that those laws came after all of this.
Right.
So up until that point, that was a huge issue on that. So we got all these factors. So we know that to this point, a lot of that, Vera, is still impacting us, and it's impacting us in a huge way. It's not something where you say, oh, I forgot about that. No, many families were exposed to this and they taught their children and others about it. The Tuskegee study sticks with us to this day.
Mm-hmm. Mm-hmm.
You have people that really can't even believe that it happened, but it did. It was the foundation of creating mistrust in this country toward the healthcare, any type of healthcare. So that is still impacting us today.
Mm-hmm.
And that is one of the reasons a lot of us, Vera, do not go to the doctor. We don't trust.
Does that continue to perpetuate the imbalance and disparity in healthcare?
Yes, it
One, we
does.
don't trust, and then we're living in places where there aren't clinics. If we,
Mhm.
we talked about there being food deserts, food swamps, and all these, but if you look at it, also we don't have good clinics in our marginalized communities, in our I don't even know what to call them, but these areas we don't have. They don't have clinics. I know they just put
Mhm.
one in this Redbird area out here, but when you even go there, they're building it up, and then you have these investors that are coming and buying out the community. So, what does that make the community now?
Mhm.
It's not a place where the individuals who this clinic is supposed to benefit really does. They just put Redbird, in the South Dallas area.
Mhm.
That
Mhm.
breaks my heart because now you want to move the people out of the community that this clinic is supposed to benefit by trying to buy up their land, buy them out, move them out. You want to regentrify and you want to move them all out.
Mhm. Mhm.
But
Mhm.
that clinic was supposed to be put there for that purpose. So again, it goes back to you saying we don't have the trust. We don't have people taking care of themselves by eating properly, having what they need, nor do we have a trust factor where they're going to go where they need to go, nor do we have something there where they can go.
That's true. That's very true. And see, all that it just ties right on back to distrust.
Mm-hmm.
So you got distrust versus mistrust. That has impacted our health
Mm-hmm.
system for years, and it still does. So one of the things that we do a lot of the times is that we just don't have it done. We don't even. But we like, no, that's all right. I'm not gonna do that. Not
I say I'm good
realize
with that.
there is a huge issue.
My goodness.
Yeah, and when I come back, I love to talk about different scenarios where we see what has happened. There's a in the literature I found was interesting the history of distrust of smallpox, where smallpox was injected into Afro Americans to study to see if they would survive.
We're
You've got
definitely gonna
other
have to have you
studies
come
of
back and
Henrietta
talk about
Lacks.
this.
I mean, Vera, it's just layers and layers of things that have happened to us as a race, and it has really, really pitted many of us to be very, very afraid of the healthcare system.
And so, one of the things I do want to mention here is that when I know you said the African American community, because we know of those type studies that were specifically against us. But when we're talking about this, everybody, we want you to know we're talking about minority communities
We're
that are
talking about marginalized minority
marginalized
community. Yes,
and minority
everybody.
communities. We're talking
Yes.
about poor communities. We're talking about those communities where people do not have access to proper care, proper food, and proper
There you go.
the ability to take care of themselves. So we're not just talking about the Black or African American race. Yes, we are talking about that when it comes to studies and how our culture thinks about healthcare. but we're also, and I do want Dr. Maudia to spend a few moments before she gets off of here and talk about how some of the studies that she's done about different types of healthcare that affects some of us. But I do want you guys to realize we are talking about when you live in an area, marginalized communities, we care about your health care. We want you to care about your health care. We want you to know that we know what some of your challenges are and that we are looking at it. We are dealing with, we're advocate for you, and we want you to be an advocate for yourself in whatever way that you can. If it means that you have to start making phone calls, if you have to connect with, if you have to reach out and say, hey, I need to get in connection with a doctor, you can hit me up. I'm going
Right.
to put the information to my ministry here on and to my coaching company here online. Connect with us. We will try to connect you with organizations that can help you. Why? Because your health matters. If you are not staying healthy, if you're not going to those appointments, if you're not going to those screenings, your mothers, your children depend on you to be healthy. Fathers, your family depends on you to be healthy. And so many times, even as mothers and fathers, we put all of that aside just to keep working, working, working. So I
Mhm.
just wanted to put that out there again, Maria, because
Mhm.
what we're talking about is you're talking about people in marginalized communities not having proper access, not trusting because of past hurts and past I don't even want to call it's not even a hurt. It's the things that have been done to our people and to the communities. But can you, because you have shared so much enlightening information in the workshops, you've done probably 4 or 5 workshops with me now for women. And each time you've shared such amazing information about diabetes, about cancer, about heart healthcare, about just all of that. Can you just share a little bit about that? I don't know if you were prepared to share some of that
Mhm.
tonight. And we're going to have you come back definitely because I want to talk about the conversation you were having with me 2 days ago about um, women, pregnant women, and disparities in healthcare for women
Yes.
and the mortality rate and all of
Yes.
that. But tonight we wanted to focus more on this part of healthcare.
Yes. One of the things that we should be doing, Vera, is really identifying that one of the first trainings I did, which is know your seasons,
Mm-hmm.
and that's for everybody. There are screenings that each one of us needs as we age. When you came here as a baby, you had screenings, you had baby shots,
Mm-hmm.
you went to the doctor, make sure you're growing right, all of that. Just think about that as you age. Think about that when you're in the years that you could get pregnant. Think about that when as you go through menopause. Think about that as you age. And men have to do the same thing.
Yes.
Many times those screenings are ignored. And there's a lot of bias thought about screenings. I have worked in the community many times, and some of the times I am just unable to even process. I'll share this with you, Vera. I was working an event several years ago, and I was volunteering, giving out mammogram vouchers, free mammogram vouchers. And all I needed to do was to give you a voucher if you needed one, and that was it. I met these two ladies that they stopped and they said, "Well, what are you giving?" And we had these beautiful bags we were giving her. And she said, "I want one of those bags." I said, "Surely." So I asked her, I said, "Have you had a mammogram?" And she said, "No, I don't do that." Her sister started laughing and she said, "The girls don't bother me and I don't bother the girls."
Wow. Wow.
And I said, "When was the last time, ladies, y'all had a mammogram?" And they said, "Oh, probably 10, 15 years ago."
Oh my Lord.
So the lady turned around and she said, "I had my youngest child 15 years ago. So I figured I didn't need any more mammograms. Well, Vera, that had nothing to do with mammograms.
It doesn't at all.
Nothing. So here we go with this biased thought. She said, I believe, she said, we just lost our baby sister a few weeks ago and she had breast cancer.
Wow.
And I said, so does breast cancer run in your family? I said, absolutely not. We don't know where she got that from. And I said, have you thought maybe you should be screened by having a mammogram, making sure everything is all right? I said, are there anybody else that has passed on a breast cancer? They said, yes. They had 5 different people they named from their mother to their grandmother.
And they didn't want to be screened?
So no need in it. So I said to them, I said, well, can I give you these vouchers where you can use them? And if I need to help you get an appointment somewhere, just let me know. So I gave them the voucher and my card. Everything went fine. About 6, 8 weeks later, one of the sisters called me. And she said, you know, I wish, she said, we kind of laughed you off that day. I said, that's all right. She said, I wanted to let you know my sister has breast cancer. And I said, did you use the voucher? She said, that's how we found out she had breast cancer. She said, I hate to say this, but I don't think she's going to make it. It's everywhere.
My goodness.
And she said, you know, we just laughed you off and didn't think anything else about it. And she never did mention you again, and I didn't either. And she said, we just kind of said to each other, we'll get around to it. Well, my sister had several knots that was she could feel changes in her breast. She did nothing about it. I didn't hear from them again, Vera, for about a year. And I picked up the phone one day when I saw in my office I had a message. The sister passed. And the very sister that was calling me was scheduled to have surgery on her breast because she too had breast cancer. Those are the type of stories that I have heard, Vera, for many, many years working in the community. They're the same stories. Different people, different years, different situations, but they are the same stories. So we really, really, really need to think and really find ourselves a good medical home.
Mm-hmm.
The ER cannot be your medical home. I'm going to get off my soapbox. The ER is there to address an emergency. That's what they're there for. You need a medical home so when your doctor can get to know you, they can get to know some of the diseases that you're prone to get. They can get to know you when they call you and say, hey, look, we want you to come in for prevention. We noticed we haven't seen you. That's a medical home conversation.
Mm-hmm. Mm-hmm.
That's what we need. The ER in the DFW region is unbelievably packed. It's all like that all over the country because many people do not have a medical home. So
Yep.
remember, the ER is there to solve your crisis, but that's it. Many of us, Vera, need to actually start getting screenings, checking our blood pressure,
Mm-hmm.
going to see if we have diabetes,
Mm-hmm.
monitoring our blood pressure, cutting back on all the salt. Sorry, y'all.
Salt, the sugar. I'm trying to cut the sugar.
There you go.
I'm trying to cut the carbs. It's my coffee. I don't eat a lot of sugar. I don't eat a lot of pasta. I don't eat a lot of the, but I have my little stuff, but I'm working on it. I'm working on it.
There
And I'm
you go.
trying to do it before my body says I'm sick of you.
I'm
Like
sick
you
of
said,
you.
the body said I'm so tired. But I
I'm
am,
sick
and
of you.
I've started a gym routine.
Okay.
Some of us try. My husband made a comment the other day. It was very thought provoking. He said, and then some of us get to the gym, we're always striving but never arriving.
Yes.
He said we start these programs, but we never get to the point where, and what he meant, we never get to the point where we get our health to the point where we're maintaining it. Your
Hmm.
stages of
Hmm.
change. We're
You're
always
right.
never get to the point where we're maintaining our health. We're just always to the point where we're always doing the quick start, jump start, and all of that. But when will
Yes.
we get to the point where, hey, I'm taking better care of myself, I'm living this life, I'm doing it, and I'm maintaining? Why is it always, oh, I got to do better? And we never do that.
That's
So
right.
then like you said, Maudia, we get to this place. I just so appreciate you coming on and having this conversation with us. And we definitely got to come back and do this, have a follow up, because like I said, this conversation
Hmm.
about pregnant women and the disparity in healthcare, but also
Oh
some
yeah.
of the things that women, not even just that disparity, but how do we care for ourselves when we're pregnant and the different things. I mean, um, but this conversation about the stages and your seasons, and there's things I don't do that I did when I was 20. I
That's
had the
true.
metabolism. I could do what I want. I could eat what I want. I could carry. I can't do that now. Know your body, like you said. Like me, I love Chinese food, but I can't eat it because of the MSG. I
Right.
it will put me on my back because of my migraine. I love wings. I'm finding out I'm probably gonna have to give up my hot wings and just different things. Know your
Mhm.
body and begin to take care of it, like you said, because it's the only one I have. I'm not
Mhm.
I'm not 20. I'm not 25. I'm not 30. I'm knocking on 59's door. Thank God. I'm very proud of it, but I can't behave the way I did. And like I said, I love the way you showed us this is the things you need to do at the different stages in your life.
Oh
And
yeah.
then, like you said, the different screenings. I have to have more screenings now that I'm older. I have to make sure I'm checking that, as we know, as African Americans, check that blood pressure, check those different
Yes.
things, and be mindful. I know before we end this, we just got about 2 or 3 minutes. Can you just quickly speak on? You said you have that place of home health care.
You
Can you
need to have a medical home.
on the medical home though? How many people you find don't statistically do not
Oh
follow
really?
the doctor's instructions? They go to the doctor, but they don't follow the instructions.
Let me say this. Some of them don't. I met a lady just a couple of days ago. This is another thing that we've been looking at in healthcare across this country, is that we've got low literacy all across this
Oh
country.
wow.
This lady, I was talking to her, and she had a handful of pamphlets and booklets and all kinds of stuff. She said to me, Maudia, I don't read. I can't read. I said, did you tell them that? She said, no, that was going to be embarrassing. I can tell you this. I said, well, okay, what if we find videos like that for everything that they want you to read? And then she said, if you can do that, and then I can get some of my church members to help me. One lady that I ride with a lot, she said she reads well. I said, okay, then so you need two things so that you can read. Us. And I looked at it was a lot of information on diabetes care. So that stuff that she needs. See, that's another thing, Vera. If you don't if you don't speak up, remember that healthcare is moving at a huge rate. So if you don't speak up and say, Dr. So and so, I need pictures on things. I need to be able to listen to things.
Mm-hmm.
Let
Mm-hmm.
him know that, you need to accommodate me on these things.
Mm. That's good. That's so good.
And I'll say this as we close. I train and work with community health workers for many years. We're seeing many community health workers be placed in doctors' offices. They're all over in the DFW in most of the hospitals. These individuals are the ones that I call them the bridge. They bridge patients to services. They're not social workers, they're not nurses, they're state approved community health workers. We need more of them. These are the individuals that can sit down and kind of plan different things with the patient, kind of help the patient understand next steps. Patient says, well, why do I have to go to the lab every time I come? Miss So and so, Dr. So and so wants to see your blood, check your blood. Oh, I didn't know that. They're not clinical, but they sure help patients to connect the dots.
Mm-hmm. Mm-hmm.
And that's what we need, Vera.
Wow. Well, this has been an awesome night, an awesome conversation. And I so appreciate you, Dr. Maudia, for coming and sharing your expertise. And I know there's so much more. I know that the well goes much deeper, what you could share and what you could talk about. Unfortunately, we couldn't get the slides to work right because I'm still learning the system and my computer wouldn't act right. But we're going to get you back on here to talk about more about healthcare and about more that you want to share on healthcare. Listen, guys, this is Vera Sadler with VLS Coaching. If you are interested in becoming a community health worker and to learn about that, reach out to Dr. Maudia Gentry. You can find her on LinkedIn. I know she's not on the other social media platforms, but she is on LinkedIn, and she will get you connected to become a community health worker and find out about the training she offers. If you're interested in coaching, my coaching services and learning how I can help you be the best version of yourself, reach out to VLS Coaching Services. I have what's called, you see it scrolling across the screen now, it's called Lift, Launch, and Lead Program. Lifting you up, launching you out, and helping you lead others into being the best you can be. We have a 12-week program that's called Helping You Pursue Personal and Professional Goals. Listen, you don't want to miss out. You don't want to sleep on this program. So again, this is Vera Sadler with VLS Coaching, and I hope to see you. We'll see you again next week on Tuesday Talk Live.